So a lot of times the types of hospitals that are considered minority serving don't necessarily have all of the resources available that other hospitals may have. Oftentimes they are safety net hospitals or kind of government hospitals, and a lot of patients may have lower socioeconomic status and not be insured. And so some of that kind of translates into just decreased access to specialists, especially in cancer, and sometimes decreased full treatment of care.
Over the last few years, we've really tried to make sure that there was a standard of care regardless of where you're getting treated. It all depended on your clinical presentation and your stage. And that's really what we wanted to focus on with this particular study, that these were a population of women who had same stage, similar presentations, and so these clinical trials would be applicable for them.
I chose to focus on patients that were just eligible for these studies. All were really more looking at early stage resectable cancers and just wanting to really compare those women treated at minority serving hospitals, so those that were kind of serving more of the Black and Hispanic population proportionately in terms of their cancer population, and then those that were serving less of those minority populations. And what we found is that, at least for the two major studies that were done by the ACOSOG, or the Alliance Network in the United States, the Z11 trial and the Z1071 trial, Black women and women at minority serving hospitals really did not have any differences, even on our unadjusted analyses. And then looking at the European AMAROS trial, although there did seem to be less of an uptake of that trial amongst patients at minority serving hospitals on our unadjusted analysis, once we did adjust for other patient factors, including age, I think being the most significant one, we did find that difference disappeared, and that there was really no association between those patients and their minority hospital status.
That minority serving hospitals are delivering great care to minority women, Black and Hispanic women. It would seem that by being COC accredited, that is one step towards ensuring that health systems meet the necessary requirements to deliver standard appropriate, stage appropriate care.